everybody. My name is Leslie Ann Johnson. Welcome to a conversation with Dr. Kester Ned, the chairman and CEO of the Jaipur Network, and we're talking about the National Health Insurance. So, good afternoon, Dr. Ned.
Good afternoon.
It is good to have you with us. So let's talk first and foremost about what exactly is the NHI. Let's put that into context so people understand what we're talking about.
Well, good morning, everyone, and appreciate the opportunity to be here speaking to the Grenadian public about this very important issue. So, NHI is a contract that a country has towards its people to provide good health care and to keep its people healthy. In a broader sense, when you think about some of the mandates stated by the WHO, the real issue about national health insurance is to prevent poverty in a country. And what actually happens is that around the world, one illness, all of us are one illness away from bankruptcy. And what has happened in many developing nations, because of limited infrastructure to support health in a country, people end up using all the resources that they work for in their lifetime to treat an illness. This is the case in many of our Caribbean nations, including Grenada, is that you could work all your life, save up dollars, and you or one member of your family could be afflicted by a healthcare condition and not be able to support the care that you need. Second reason why national health insurance is so important is to prevent something called premature deaths. Premature deaths means that people dying before their time. When I look at the population distribution of the Grenadian public, when I was growing up here in Grenada, we had a lot of old people living. Today, more than 70% of the Grenadian population is under 60. So you have a shrinking number of aged individuals. When you look at developed nations like Sweden, the United States, Canada, and others, some of the fastest growing segment of the population are the older persons. So that's a scary statistic. And when you think that in Grenada, about 30% of the people are 60 and above, and those individuals are about to retire, and guess what? They have pre-existing condition, diabetes, high blood pressure, and just about no insurance company will cover them because of pre-existing condition. So most retired Grenadians don't have access to health coverage, and nor do they have access to the kind of health care that they need in their closing years to service their needs. And that's why that's one other reason why national health insurance is so important. But let's not forget the younger generation. The whole idea of preventing catastrophic illnesses or illnesses that are non-communicable. Well, no, we have some communicable infections that are taking over, like HIV. Certainly, we know about COVID virus caused by the coronavirus. And certainly, infectious disease is on the top of the list nowadays in terms of us dying or being maimed from an infectious condition. In the Caribbean, we have viruses that are not present in other parts of the world, causing major illnesses. We have the mosquito-borne conditions that are affecting all of us in this territory. And so we, at any point in time, could be subjected to diseases that many other nations don't have exposure to. And yet we are not as prepared to handle those kinds of situations. The rates of cancer. When you think the WHO published some statistics that we would have a 40% increase in cancer rate, and that was about 5 years ago, over the next 15 years or so. And cancer is a very expensive disease to treat. And in today's world, lots of people are living and surviving cancer. So clearly, young people need to pay as much attention to this issue, and some of that has to do with lifestyle. issues. Those are very important issues that we must be concerned about: smoking, excessive alcohol use, obesity. All of those issues are important in this society from a long-term perspective to preserve life and to live with quality. If we want to have a quality of life in this society, we need to pay attention to our healthcare issues starting at an early age. We have to educate our kids about the importance of good healthcare.